Hello, my name is Amanda Woodward, and I will be discussing Pamela Reed's theory of self-transcendence using this concept map. The theory is comprised of three main concepts. The first, self-transcendence, is the expansion of a person's usual boundaries inwardly, as in gaining a greater sense of spirituality, or an integration of the past and the future, which give meaning to the present. In my case, I'll be using it to develop insight in a psychiatric patient. Well-being, she defined as a concept a feeling of wellness or wholeness, however the patient defined it. And the third, vulnerability, was an awareness of personal mortality. And in the case of a patient with schizophrenia, this mortality could be real or imagined. Reed posited that increased self-transcendence is positively linked to well-being, whereas decreased ability to reach out to others or decreased self-transcendence is linked to depression or poor mental health. With some creative thinking, this theory can be applied to working with patients having serious mental illnesses and even schizophrenia. As is the case in many forms of mental illness, self-transcendence and well-being are low, and vulnerability can be high. The vulnerability can be real or imagined. However, alterations in normal thought processes do not exclude the incorporation of this theory. The nurse's role in the recovery of the patient with schizophrenia is based on building a trusting relationship. Paranoia and skepticism are frequently a wedge between the patient and recovery. They keep the patient from taking the medicine that may restore prior mental wellness. So, the building of rapport, assisting the individual to feel safe, and helping to reduce stress will all help in this regard. The psychiatric nurse should nurture the patient's self-transcendence or ability to connect with others and increase their insight. Numerous ways of doing this exist and are unlimited, as are the patient's preferences. The ways of doing this can be tailored to the patient as rapport and trust develop. Favorite music allows the patient to connect with others who also appreciate that music. Pet therapy animals can help the patient to connect with other non-threatening person or other. Sometimes I have found that asking about a person's past successes can help a patient to link their health status with prior positive behaviors and to keep them from being hospitalized in the future when they identify what they have done in the past. Well-being can be promoted in various ways which become clear to the nurse with therapeutic interactions. For example, if the patient is afraid to take a shower because they fear someone will enter the shower room, the nurse can stay outside of their bathroom to protect them from the imagined threat. This in turn would help build trust and increase well-being. Very often the patient with schizophrenia presents with an expectation that their ideas or thoughts will not be believed. The nurse can purposely find something to agree upon with the patient to help increase morale and trust. In small ways, a therapeutic relationship can be built, which can lead to changes in the sense of vulnerability. The patient experiencing an acute episode of schizophrenia is often difficult to manage due to an altered sense of reality and their perceptions. Building a trusting relationship with attention to matters elevating self-transcendence and insight will ultimately result in increased well-being. I chose Pamela Reed's theory of self-transcendence initially as I thought it would be applied to my work setting, the acute inpatient psychiatric unit. I knew that Pamela Reed had an advanced degree as a psychiatric mental health nurse. As I was reading and processing the concepts, I realized that I could actually apply this theory to a subset of patients, those experiencing symptoms of psychosis in an adapted way. I've always attempted to develop trust and rapport with my patients, but I never really thought about the extreme value of it, instead placing more faith in medications to return a patient to baseline functioning in cognitive and psychiatric health. However, I came to realize that more effort must be made by all members of the healthcare team in developing and improving relationships with patients during every stage of illness. This theory gives that goal structure, which could lead to improved outcomes and quality of life for the patient. The meta-paradigm of the transcendence theory makes the following assumptions. Nursing assists others by a therapeutic use of self and the environment. The person is defined as the developing individual whose health can be positively or negatively changed by the environment. Health is resultant of all human experience, but which varies depending on a person's values. And finally, environment can be defined by family, community, therapeutic bonds, physical settings, all that contribute to health. As they develop through the lifespan, human beings become increasingly complex and possess a natural ability to grow spiritually, physically, and emotionally. Boundaries between people change through the lifespan and during illness. These were all the assumptions. The propositions of this theory included encountering life-threatening illness can increase self-transcendence. Well, as stated, it's more difficult with those experiencing psychosis. And I believe that self-transcendence, as defined by insight and becoming more aware of reality in your situation, is possible but more difficult. Also, another proposition was self-transcendence is positively related to well-being, and conversely, a decrease is related to depression. And that, I feel, is very true. Thank you for listening to this presentation.